Good evening, and thank you for joining us on Fox 24 News Now. We've talked a lot in the past about Alzheimer's and the increasing numbers of diagnoses across the country, but haven't addressed the acute impact on particular ethnicities until tonight. I'm happy to be joined by Dr. Thaddeus John Bell, here to talk about the effects of Alzheimer's on the African American community. Thank you for being here.
Thank you very much for asking me.
So first of all, what I kind of want to understand and get a handle on is what is the propensity for the African American community to visit the doctor to find out if they're starting to see signs of Alzheimer's?
Well, it has been a problem in the African American community for a long time to think prevention. And so, as a rule, African Americans have not gone to the doctor like they are supposed to in order to prevent things. We have been crisis-oriented, so we only go when we get sick. So that's changing now within the past several years. And so we are now more inclined to go and find out what our medical problems are so as to prevent major complications down the road. But it continues to be a major issue in our community.
Mm-hmm. And what do you think that is? Is it a cultural thing?
I think it comes from several origins. I think the socioeconomic status of African Americans has played a major role. I think the lack of education, of understanding why they need to go. I think a major mistrust of the medical profession has played a major role as to why we have not gone to the physician or be involved in health care prevention. So it's a combination of things. I think racism has played a role in it. Mm-hmm. So I think there are a lot of things that have played a role in this.
But you say that things are starting to turn around a bit?
Things are starting to turn around. I think certainly Obamacare played a major role in making access to care more affordable to African Americans. I think programs like Closing the Gap in Healthcare, particularly in our community, where I have spent my entire medical career educating African Americans about the perils of not going to the doctor. And I think, talking about health on radio and television has also played a major role.
So you'd agree that it's important to just get that message out there in a forum where they're most apt to receive it?
Absolutely, and in a way in which, in a forum for sure, but having people talk to us in a way in which we can understand the information, and also I think having a level of trust that the information that you're receiving from the healthcare provider is also important.
Let's start to talk about the numbers of diagnoses across the country. So certainly we've seen an increase, and this is pervasive amongst all ethnicities.
Right.
What if we were to target African Americans? What are you seeing in terms of numbers for them?
Well, interestingly enough, the CDC just came out with a report showing that there was an increase in the number of diagnoses of Alzheimer's as well as other dementias made in the African American community. I think that the thing that has contributed to that is people becoming more aware, people living a longer period of time. I think that younger people now are finding themselves taking care of their parents, and so they are more aware that this disease is very, very prevalent.
Mm-hmm. And of course, we're speaking of Alzheimer's, but also with other dementias. These particular diseases do not have a cure. There are signs, and it is a progressive disease. We're going to be talking with Dr. Bell further about this and some of the other impacts in our daily lives that could potentially increase the chances of having an Alzheimer's diagnosis. We're going to be talking about that after the break. We'll be back after this.